Today's presentation is about
Oh,
preparing
no, I don't need to be seen.
expected and the unexpected. Most of you know me, nurse practitioner at UC, but our wise person with Parkinson's today is Carol Simons. Carol, it's all to you.
Thank you. I'm Carol, and I'm here to tell you about 3 different topics, actually. The first one is we're going to talk about organizing ourselves. Next is important lists to have. And the third is I'll talk about emergency health packets, which are really important. Well, you all know that Parkinson's is a chronic progressive illness. And over time, we will meet with a lot of different medical people, doctors, nurses, trainers, physical therapists, and on and on and on and on. And each of us will develop our own unique medical team. With so many people involved, how can you keep things straight and be organized so that our questions and our fears, our experiences, and our discoveries are not lost in between visits? We want to be able to interact with our medical team so that we can get their maximum help. Research shows that if we are involved with our health care, we experience much less stress and do much better in general. Okay. There are lots of ways you can get organized. This way that I'm going to show you is one that I use and I find very effective. Maureen, do you want to?
We're on Start a Notebook.
No, I'm not.
No, you're on the next page.
I'm not. I'm just on the computer screen.
Are you trying to share your screen, Maureen?
It is shared, isn't it?
It is not at the very
I'm
bottom.
sorry. I thought I did.
It's okay. I'm sorry. I thought maybe you were waiting to present it.
So when I tried to hit share before, when I pull up the PowerPoint, the share goes away. So that's why I hit share.
Okay, when you hit share.
Okay, how's that? Do you see it now?
Yeah.
Perfect.
Okay. All right.
Okay.
Perfect.
Sorry.
No, you're fine. Technology can be hard sometimes.
Organize. Let's get going. The first thing to do, I found, was to start a notebook. Use it to keep track of day-to-day health happenings. A health notebook is just a handy little book to have somewhere that's easy to locate, and it should include the date, mention of the issues or the health happenings, and other information that would be helpful to your health professional. Include motor and non-motor symptoms.
Next slide.
No, the symptoms are affected by fatigue, stress, cold, and other illnesses that you may be dealing with. So your documenting should contain the conditions. For example, I would write June 12th, 2024. I lost my balance and almost fell in the shower, and I never before had done it. It was in late evening. Another example would be on July 2nd, 2024, I began to notice hesitation when approaching doorways. It happens most when I'm moving fast, trying to move fast. And on July 30th, my sinuses started to drip. I think it's mostly from allergies, and it happens most often in the evening. And the last is in August, I got August the date, got a flu shot, and my Parkinson's symptoms got worse for 2 days, and then they went back to normal or regular. Keeping this record and communicating these items to the medical team is a key. So the simplest thing is jotting down and keeping a record in a notebook. Next. The next important part of being organized is creating a folder for each doctor or medical provider that you have. It's just a plain folder. And if you put the name and telephone number on the outside of the folder, that's all you would need, and do it for each of your medical providers. On the inside, then, this is where you start collecting emails, doctor assistants, the names, addresses, everything you can about the doctor, and then also things that you come about during your time away from the doctor. You could put questions in, issues that come up, and you don't want to forget them. So having a folder for each doctor is really important. And then you could put all the folders together and keep them like I have in one place. And that way you don't lose and go crazy looking for things before your meeting. So your notebook and your folder are key. Next. Now you're getting ready for an appointment. Before the appointment, check your notebook and your folder for any information to share with the doctor. Prepare questions and write them out on a master plan. This isn't fancy. This is really easy. Write down your questions and then prioritize them so that the most important questions are addressed during the meeting. I have this bottom one, medication changes is really important for this meeting. And then sleep problems are a second, and falling is a third. So this person is prepared to meet the doctor
No.
where in the at the meeting, well planned. Be sure to have an up-to-date list of medications with you. Include information about new medical providers that you may add. Education visits. They always want to know about falls. So include that, and have a list of surgical procedures and new diagnostic testing with you too, so that they know exactly what you're exposed to. Next. After a visit, create a second file folder if you find that your first folder is being overflowed. Use just a second file folder or a simple 3-ring binder for each medical partner. that shares a lot of information and handouts with you. Label these binders, again, with the name and the occupation of the doctor or medical person. Place your answer sheets in this folder, and that will keep them safe. And it would include everything from MRIs, blood work reports, research outcomes, and notes from the doctor. Next, there are some important lists and charts that you should have. Now, these take a while to put together, so don't get frustrated. First, a chart or a list of your medications and all your supplements. Include the name,
me that white little coverlet.
the strength, the amount you take, the reason for taking it, and any additional information. And this is a list of medication and supplements that I have.
Better?
Yeah.
The doctors and therapists is another important list to have, and that just includes the occupation, the phone number, the address, the email, and the assistant's name. That is helpful. And the third list is the medical history, and that is good to have. Not as important as having your up-to-date medical medication list, but it's handy to have in your file for your doctor to know what your past is. The last thing is a medication diary. It's a 24-hour chart used for adjusting medication. Patients keep track of each medication, the time taken, and the response. Patients keep track of their medication, and every 30 minutes, they chart the response that the medication they're giving them. You take 2 or 3 of these diaries to your doctor, and this is a sample diary that could be used, but there are many diaries through the Parkinson's Foundation. You could get a diary, or through Parkinson's Support and Wellness. If you call, they could email you out one. But they're really nice for charting your medications. I just got the hiccups. I'm sorry.
Can I jump in here, Carol?
Yeah.
Yeah, so I think every 30 minutes is really detailed, but basically when we make a medication change, you know, especially if we're talking about on and off times or dyskinesia, that's when you want to know. So when it happens, did the dyskinesia happen before your next dose? Did it happen another time, maybe peak dose? Those are the things. Or if you get nauseated with Cinemet, you know, when does the nausea occur? So that's why it's kind of important, you know, every 30 minutes, people may not want to do that. And I certainly would not want to do it myself, but a generalized response to medications in this diary is really helpful for your doctor's appointment.
Yeah. Yeah, so those are the 3 important lists to have, and then the medication diary is an asset to helping work out your medications easier and more effectively. Then the last thing I wanted to talk to you about is an emergency health packet. If all you need is envelope, it could be anything like this, or it could be a plastic Ziploc one. But in it, you include medical health, a medical insurance card, and a photo ID, medication list, the doctor list, and the medical history list. All three of those. Your living will, or if you instead have a healthcare power of attorney, a copy of that should be in. And then some people like to make it very thorough and include the general power of attorney, which is the financial will of the person. A lot of people put these packets together and put them in the refrigerator, in the freezer, and put a medical magnet on their freezer door. A lot of first response people will come to your home and will check the refrigerator, because that's a common place for them to find in the medical world. It's a common place to find this healthcare packet. Is especially important for the first responders, and it shows you how your lists come in handy, besides just for
emergencies.
emergencies. Yeah. I have a retrieval of word
Word retrieval problem.
yeah. And so when I get excited, I sometimes can't retrieve as fast as I want. And it's good to tell your audience about that, so that they know that you're dealing with something that is important to know. All right.
Okay, so my part of the lecture is about hospital safety. People with Parkinson's are at a much higher risk of hospitalization and face challenges in the hospital. 4 out of every 12 people with Parkinson's will be hospitalized every year. 3 of the 4 won't get their medicine on time. I'd have to say 4 of the 4, honestly. And 2 of the 3 will have complications as a result. Those complications can include the risk for falls, swallowing changes, muscle deterioration, medication side effects, medical and physical decline, and certainly decreased independence. The next few slides, the pictures don't come out very well, but this is a hospital safety guide that's put out by the Parkinson's Foundation. And I'm going to give you the website at the end of these pictures, okay? I just took them with my phone, and then when I tried to transfer them, they didn't come out so well. So there's a sample medication form in there. It's 2-sided. Again, I don't want you to have to get spaced out about reading this. I'm just letting you know what's in this book, besides a lot of other information. There is a doctor's letter for Parkinson's hospital care needs. And it goes over things like, let me pull mine out so I can read it. So it says below, I've outlined 5 care priorities for this patient. So the doctor writes this letter, okay? And you can just give it to them and then it can go in their chart. So number 1, they need their medications ordered in an individualized fashion according to how they take them at home. That's really important. A lot of hospitals, including nursing homes or any acute care facilities, will just put you on their standard time frame. So if it's every 4 hours, you know, for them, it might be 8, 12, 4, and 8. But for you, it might be 6, 10, 2, and 6, right? So hopefully they'll take that into consideration. Secondly, the patient needs to take their PD medications within 15 minutes of their at-home schedule. And that's something that we fight all the time. The patient needs to avoid medications that make their Parkinson's worse, including dopamine blocking medications, sedative, and certain medications for pain. And then in the sentences below that, they point out some of those medications. The 4th is they need to move their body as safely and regularly as possible, ideally 3 times a day. And bed rest should be used as a last resort. And then 5th, you should be screened for swallowing changes to minimize the risk of aspiration pneumonia and weight loss. So then so we're on the 2nd page now, and the doctor can sign this, and this can go in your chart. This is also a great handout, Parkinson's Care Summary for Health Professionals. So it talks a little bit about all of the different symptoms in this first part: freezing, lack of facial response, all of the Parkinson's motor and non-motor. And then talks about 5 care considerations and pretty much what the physician letter stated. You want to customize the medications, you want to prevent delays, you want to avoid contraindicated medicines. And again, they give you a full list of that. Prioritize regular movement, address the risk of dysphagia, the swallowing problems, or aspiration. And then on the 2nd page, they list the antipsychotics, the anesthesia and pain medicine, and the GI and nausea medicines. So these are great resources, and and this is where you'll find it, www.parkinson.org hospital safety. You can either download it or you can order it and they will send it to you. Okay. I highly recommend it because it has a lot of other good things, tips for preparing for surgery, you know, just helping you understand what might be happening. There's
Can
a
you
place.
repeat that, please? Can you repeat that website, please?
Sure. Can't you see it on the screen?
No, my husband has it facing him, so.
Oh,
and-
okay.
It's at the top of the
Yeah,
screen.
no problem. It's parkinson.org. And then / hospital safety, all one word. And like I said, you can either download it or you can order it. And
Thank you.
They give you multiple copies of the list that you can just tear out of the book. It's just an awesome book.
Thank you.
Okay. All right. So what kind of reasons happen for hospital admission? Well, your motor complications can get worse. Of course, the most common is a fall or fracture or pneumonia. As we age, we can get cardiac issues or syncope that can be either from cardiac or orthostatic hypotension. Probably the most frequent cause is UTIs or urinary tract infections, GI issues, drug-induced psychosis, general medical problems, or combined motor and psychological problems. So if this is an elective hospitalization, it's great. You can really plan for this, right? So for instance, knee replacements. That's a common thing, or a hip replacement. You want to discuss with your surgeon about your meds. You want to make sure the dosages that you take are the same as prescribed on the bottle. This is really key because you know how often we change medications. And most often don't send in a new prescription because you have a ton of them already. So it might be good to check your MyChart account if you can, or to call your neurologist for a list of your most current medications as well, in case you haven't kept things up to date. You really want to be your own advocate and talk to your doctors, talk to the nurses, explain what happens when you don't get your medicine on time. You know, this is a big education area for you to take advantage of as well. You can't leave it all up to, you can't assume that they know anything, because believe me, they don't. So the pneumonia is the most common cause of death in Parkinson's. There's a risk of aspiration. So what's that mean? That means that when you might choke and something goes down, instead of the esophagus to the stomach, it goes down the trachea and into the lungs. And that can develop pneumonia, something foreign in the lungs. So at times you may need a temporary feeding tube, and that helps with medication intake. You know, at least you can get your medicines on time, but it doesn't improve your swallowing. So, you know, your doctors have to be aware that you might really require aggressive pulmonary care. Bladder infections is another big one, because bladder infections can cause confusion, hallucinations. You know, it just throws you completely out of whack. So they have to be treated aggressively. And if you've ever called me with, you know, some sudden change in the person with Parkinson's, the first thing I'm going to say is either A, do they have a UTI? Have you noticed their, you know, urine is different? Or B, are they on some new medicine? Or does the medicine look different? Because some of the generics don't work as well. We know that. So psychiatric issues. Most often it's drug-induced psychosis, and that can happen from getting on the wrong medicines, some antipsychotic you shouldn't be on, or perhaps your levodopa got increased and kind of threw you over the edge. So there's 3 drugs that are effective for treatment. The first we usually try is quetiapine, because it's more cost effective. The second is a newer drug, which is pimavanserin or Nuplacid. And then the third drug is clozapine. Clozapine we save as the third option, although it's a great drug, but it has a high risk of lowering your white blood cell count. And so it's very strictly monitored, and you have to have blood draws for every week for the first 6 months, and then every 2 weeks for the next 6 months, and then once a month. And when I say it's highly regulated, it is. There's a Clozaril registry. We have to be sure the pharmacy gets the blood work. We have to put it in the registry, or you won't get the medication at the pharmacy. So those are the 3 drugs we use for psychosis. Also, it's important to differentiate when anxiety comes up, because some people can have anxiety as a wearing off phenomena, or some people just have generalized anxiety, and you have to treat them differently. And it's not necessarily a psychiatric issue. So the chief difficulty in the hospital with hip fractures is pneumonia and delirium. So fall prevention is the most important safety practice to follow. If you're at risk for falls, you need really close observation and measures to avoid walking without assistance. When we talk about pneumonia and delirium is a state of altered consciousness. Okay, it's not just confusion, it's worse than that. So we have to be very careful and watch for that. All right, a real important syndrome is called the neuromalignant syndrome. And this is characterized by rigidity, dysautonomia, and changes in mental status. What does dysautonomia mean? Temperature regulations, problems, they get a high temp. When I talk about rigidity, I mean they are stiff, rigid. You can't move their arms or legs. pressure fluctuations, temperature fluctuations, bowel fluctuations. The most common cause are the neuroleptics that are dopamine blockers. And these are some of them. Now, most of these are older drugs. Promethazine is still used a lot for nausea, and that's a huge caution. So the only safe drug for nausea in PD is a medicine called Zofran or ondansetron. Okay. So all these drugs are newer antipsychotics. You hear them, you hear a lot about Rexulti advertised on the TV, but these block the dopamine and they lead to muscle stiffness and rigid movements. And then that contributes to the neuromalignant syndrome. And if that neuromalignant syndrome is not caught early, it can cause death. So it's very important to remember these drugs for the advocate, the person with the partner, to be aware of what drug changes are happening. I don't know why clozapin's on that list. I got this from the Mayo Clinic. Interesting. All right, so how is the diagnosis made and what's the treatment? Well, it's a clinical diagnosis in the setting of exposure to a neuroleptic. And it can commonly be misdiagnosed as sepsis, which is a blood system infection. So how do we treat it? Well, first of all, we got to recognize it, and that can be tricky. But secondly, then they have to take immediate withdrawal of neuroleptics. And then they use two drugs, bromocriptine and dantrolene, and that helps reduce the muscle rigidity. And you want to resume the previous doses of levodopa. Now, this scenario can happen in the face of maybe some acute nausea and vomiting. They're not getting fluids, they're not getting their medications, and especially withdrawal of Sinemet actually can also contribute to this. So we want to be really careful when people aren't eating and drinking and taking their medications to be alert for this. And that's when they'll put in not usually a feeding tube into the stomach, but at least a nasogastric tube so that we can get medications in. So elective hospitalizations. If it's possible, go to the hospital where your neurologist is on staff. Well, if you come to UC, to GNI, then it's just UC or Westchester. Find out what the hospital rule is for taking your own medication. Typically, they don't like you to do that. However, there are some more expensive drugs that may not be on the hospital formulary, such as Rytary or Nuplacid. And so you may be able to bring those in. And that's where it's important that what's on the bottle matches what your dosage is, right? Ask the nurses or physicians to tell you about any new drug prescribed. And this is where your partner in crime comes in too. You've got to stay on top of that. I just had a call yesterday from a patient's daughter. She's in rehab up in Columbus, and they gave her Haldol for agitation. Like, no. They can't do that. I also ask the patients when they are in the hospital, then if they want to change any neurology medicine, to call the attending. And most of the time they will, let us be in charge of their medicine while they're in the hospital. You want to avoid all those neuroleptics or the antipsychotics I told you about and the anti-nausea medication. And then again, for nausea, you want to ask for Zofran, or ondansetron is the generic name. So how do you cope with all this, especially if it's kind of an unexpected, unplanned surgery or hospitalization? If it's planned, you can do a lot of education and anticipatory intervention. You can let your neurologist know. Lots of times I get phone calls, you know, hey, I'm going to have a knee replacement. What do you suggest? And we go over some of this stuff. If it's something, well, even if it's a hip replacement or a knee replacement, you might want to ask to meet with the anesthesiologist before the morning of surgery. And that would be to identify what kind of sedatives they're going to use. Because if perhaps you've had surgery a long time ago and you got horribly nauseated, you know, you can share that information, and the drugs are much better now. They don't usually cause that nausea, but again, it's kind of planning and hoping to reduce the risk.
Got a question, you can go ahead and.
You always want to think about rehab after surgery. You know, you may or may not be able to go home, and a short stay in rehab could be really beneficial. If your level of consciousness isn't affected, you want to make sure that you move in bed, okay? If you're allowed to get up on your own, that's great. Most of the time you aren't. But, you know, can you change your positions? Can you move from side to side? You don't want to just lay in bed flat on your back. It's not good. You have to keep moving. Do your leg exercises, do your arm circles, you know, you can move when you're in bed. And also you might want to arrange for caregivers in the hospital if it's going to be a prolonged stay, and maybe you can call some people preemptively. Hey, if I'm ever hospitalized, do you think you could look in on me or stay with me for a few hours? Again, most of your friends or family are more than willing to do that. They just need to know. Ask about therapies, physical therapy, respiratory therapy, OT, speech. Maybe you need a consultation with a sleep specialist while you're in there if you've been having sleeping problems. You know, the difference is hospitalizations are as short as possible these days, right? You're in and you're out. So when they're more prolonged, all of these things typically happen on their own. But if you're going in for a joint replacement, I had a patient who lived alone who absolutely had to go to rehab after her knee, and her orthopedic surgeon would not agree to that, despite the fact that I had Dr. Duker call and discuss it with them. He absolutely refused on the basis of the potential risk of infection. So we told her she had to find another, you know, orthopedic surgeon. She could not go home. It was just crazy. So you really have to anticipate what you might need. There's always home care, there's in-home therapies, but that's not quite as good as going to a rehab place, okay? So again, it's an opportunity to talk and educate people. And if all else fails, I'll send in Polly and she'll help you.
Good.
Look at,
So cute.
That's good. That's good.
Mhm. Okay, questions?
One that I would like to add before we start questions is I meant to mention that any papers that you hand in to a doctor's office should have your date of birth on and your name. That's to prevent it from your material from getting mixed into somebody else's file. So always, anytime you hand in anything to the doctor's office, have your name and your date of birth on it. Okay.
I agree.
Yeah.
I see that Shelly has her hand raised. Shelly, if you want to unmute your mic.
It is, thank you. So Maureen, just about 2.5 weeks ago, I had my knee replaced and I'm in the process of healing now. Just for everyone's information, I went to St. Elizabeth in Florence and they could not have been more accommodating. They were incredibly conscientious about all of my needs and all of my concerns. But my question is, when I was waking up from anesthesia, I had what I would consider to be a panic attack. I'm wondering if that was medication related.
It probably was.
I was having problems breathing,
Mm-hmm.
and just got so incredibly emotional. I needed for them to bring my son back to me so that I could calm down.
Yeah, and you might want to ask them what anesthesia that was. So
Okay,
that if this happens in the, you know, if you have to have some elective surgery in the future, that you can tell them about this reaction.
okay,
Yeah, those are the things that are important,
Yeah.
you know, for you.
right, thank you.
Mm-hmm.
Mary Jo?
Yeah, I got a couple things. I forget what month, but I had 911. I had to call 911 and I was having an allergic reaction. And when I got there, thankfully they took care of it and stuff. But I remember the nurse saying, if you are hospitalized, we don't have your Parkinson's drugs here, So I've got a bag. I put all my drugs in this, and that's how I keep them in case they have to be grabbed. And then I've got one of these. I've got a bunch of these things you put on the outside of the fridge. It's a magnet, and I keep updating, like you said, because that's what was happening. I was having drug changes. And then I tried to take photos and put them on my phone too, of all those papers you said to keep in a bag. I think that's a good idea. But now I forget where I got them on my phone, and I don't have them updated as I should. And I need lessons on how to do all that. But for taking trips or just going out. And the other thing, I make sure I've got extra drugs in each of our cars for Parkinson's, and it's a mess, But
Mary Jo, you can create a folder in your pictures.
okay, I think I did, but now I forget where I did it, where I put it. It's all here somewhere.
Well, in November, we're going to have this educational session about technology. So
Oh, good.
it'll be great.
Well, and the other thing going on is when you call, I've got 4 different prescriptions for carbidopa. I take 2 of them. 2 of them I don't take. But when they send me a note saying your prescription's ready for refill, I keep trying to tell them, you have to tell me, is it the immediate release or the slow release? Is it the little yellow pill or the big blue pill? Which one? And that's just frustrating.
Thanks for sharing that.
One thing about going to rehab, some places like Dupre House, and there's several of the places, really good places you can go for rehab, is to think about when you're going to be going. And sometimes you don't have much control, but I've had friends who have gone, been in the hospital for surgery and then gone to the rehab place like on a Friday. And then over the weekend, there's nobody there.
Right.
And they don't get the physical therapy or anything. So it's kind of important, if possible, to arrange for a different day in the week to go to those places.
I have to say that's a great idea, but probably nearly impossible.
Probably,
Yeah.
but it's
Typically
it's worth
physical
a try.
therapy's there on Saturday. You may or may not get the best evaluation, but typically PT is there. But yeah, Sunday's useless.
Yeah, it's almost of course it's been a little while, but it's almost like you're better off at home and bringing somebody in your home if you can do that too.
Except for the expense of that, because
Of
rehab's
course.
covered.
Yeah, there's always that.
Yeah, yeah. Any other questions? We see something in chat. What's that? Joe says, I write notes on the text area of the appointment of my schedules.
Now, when you were talking about the notebook thing, I like when I have some information and I have an appointment set up, I just put it in. So when I am ready for the appointment, it's like, oh yeah, I was gonna tell the doctor this,
Mhm.
you know.
Yeah, I have on your, if I have an iPhone, so I don't understand Samsung, but there's a place to make notes, right? So you can
Mhm.
type your medical notes in there as well, create a folder for notes.
Yeah, no, this is just in the schedule itself. There's like,
Oh, okay.
yeah,
Okay.
yeah, yeah.
Carol, when you
Also,
were,
when you were talking about, I got one of these, where is it? One of these. Well, I can't, here it is. Well, I can't, it's one, yeah, one of the books,
What I showed, yeah.
Hospital Safety Guide, and I was looking through it, and the last page has two cards that you can tear out that are medical alerts
Mhm.
that you fill out and carry with you. And I thought, well, that's pretty handy. And it
Yeah, that
also,
is too. Mhm.
yeah, and it also tells you can download, yeah, there you go. And you can download, I think for your phone, but this is right here and you fill out your name and your address and who to contact and your physician. And I think on the back, some more information. Oh, the medication list of medicines that they should not use.
Yeah,
So hoping
this
that they'll
one
pay
is
attention.
really, really helpful. This Parkinson's Care Summary for Health Professionals. I think
Yeah.
this is just an excellent
Mhm.
piece.
Sometimes you can get a bracelet, it used to be, I don't know if they still do that from Parkinson's Foundation, that you can wear. Of course, a lot of people won't wear them, but because sometimes when you're out, I don't know about the rest of you, but a lot of people walk like they're sort of drunk, including me sometimes because my back hurts. Then it really helps to have that bracelet on. So if the police, should happen to think that you're drunk, you don't get hauled off to the funny farm. And I have a friend who's diabetic that sort of happened to. He wouldn't wear one, and he was driving and got arrested.
well, I remember the old days when I had just a little thing about that big typed up and put in my wallet. Those days are over. This is the form that they've got in that magnet thing, but it's so much, and I don't know. I keep revising things. Oh, and then you were talking about a notebook, keeping a record. Well, my problem is the handwriting. It's hard to write. So I came up with this list, and my sister-in-law helped me, and kind of a chart, and I can fill in, like if I'm having, this is when I was first starting to have downtime problems. And balance, light. I mean, I've got a little cheat sheet, an abbreviation. And so that's easier for me than trying to write a whole thing that I can't even read my own handwriting.
That's where you ask your grandkids.
Oh,
Yeah.
I know.
Or
Well,
if you're somewhat computer savvy, you can keep a running copy on the computer and then print it
Mhm.
out before your doctor's appointment.
Yeah. And
That's
my
what I do.
updated emergency list, I keep adding to it. Like I know if I call your office, if I press 3, I get a medical problem. If I press something else, I get a recording. So I put those little cheat hints on here, and the fax number. I mean, it's just adding.
Yeah, I think that's what Carol's folders idea. Those are great.
Yeah.
When she said, put the name of the assistant, if you come to GNI, it's a rolling door. We can't keep anybody anymore. But I'm there.
but it's updating it.
Right. And again, that's where I encourage to get your care partner involved, especially if you're having any kind of cognitive issues.
Mhm.
Or it doesn't have to be your care partner. Maybe it can be one of your grandkids or a sister or a brother, or, you know, a good friend. People are willing to help with those things.
Yeah.
Something new in the chat. We tried pen again, a special pen on Amazon really helped with writing. Becky said that.
And
We never
again,
heard of that.
Hmm.
I haven't either.
Pen again, P-E-N, capital A-G-A-I-N. I have to look that up.
Yeah, me
One
too.
of the one of our partners at the NeuroFit gym, their occupational therapist recommended that.
Uh-huh.
And it reduces the fine motor skill to a gross motor. It isn't a pen like you or I would think. I have one. I doubt that you could see it because of the background, but you hold it with your forefinger and that guides the writing. And it really, really helped write more straight and write your signature.
Good,
Right.
great.
I think there's some eating utensils that are like that, that they compensate for the trimmer. But I haven't heard much about them, but I think they're kind of expensive.
So in the chat, we have, are we going to have access to the notes slides? Recording of this presentation is occurring and it will be put on the website. Maureen, are you wanting to also send out a copy of the presentation to people today or just have them access it through the video?
If you really want a copy of it right away, I'm happy to share it. You'd have to, can you email the office for that? The Parkinson's,
Yeah.
parkinsoncincinnati.org.
Yeah.
Yeah.
So Karen says, I also use a microphone on my phone to take notes, text, etc.
Does anybody have a Samsung Android? Like, what do you use for notes on that? What app?
I don't know.
Okay.
I used to have one that's got its own notes app on there.
It probably does.
Yeah, I mean, that's what it says is Samsung Notes.
I didn't know if there was a special
No,
program.
it just says notes, probably.
Okay.
Yeah.
Look in your settings and then keep looking.
Well, I downloaded something recently and I took it right off. It was trying to get me to make commitments to do all kind of organizational stuff and that. I thought, oh no,
Yeah.
God, no.
Yeah.
I want to know where Joe Light is with the water behind him.
That's me.
That's
A
just
poster.
that's just a screen background.
Oh, yeah, that's it's a picture I took years ago off the Oregon coast whale watching.
Mm,
That's the whale I was watching.
Ah,
Oh, that's neat.
They're not very cooperative when you're trying to take their picture, apparently. It's like, oh, there it is. Oh, I missed it. Oh, there. Yeah, so I got its tail.
Oh, that's good.
Yeah.
I think some of that depends on the whale.
you think?
Well,
Yes.
some whales like to get their pictures taken. I mean, I've had friends who go out whale watching and the doggone things will put on a show.
Yeah,
They'll come up and they'll breach, not right where they are, but where you could get a really good picture of them going thung into the water.
well, that may be, but I think there were a couple, and it was like, oh no. And
Yeah, we have some that don't want to do that, but as I said, there are other places that I've had friends who do whale watching who've gone out and gotten really great pictures of them, and you get sometimes if you've got dolphins around when you're doing that same thing, they'll get up on their back end and do the flipper thing of going across the screen,
And I think it's different types of whales. I think these
Yeah.
whales, I forget which kind they were, but they're kind of shy. I think they're not very
That's probably
aggressive.
because they've been heavily hunted.
Yeah,
The ones that were oil whales do not like to stand up, but there are other ones, especially in the Pacific Ocean, who can horse around and be silly because there aren't as the Japanese are the only ones who do whale hunting out there.
yeah.
Well, this was a great topic. Thank you for doing it.
You're welcome.
Thursday, I'm having a test done. It's only an hour or so. But the day before, I'm going on a bus trip and I got to make sure I take enough pills and water and
Yeah,
what all.
So in case you don't have the access to a computer, I want to give you the Parkinson's Foundation phone number, okay? It's 1-800-473-4636. And I'm sure if you call them and ask them for the hospital safety guide, they'll send it to you. So thanks, everybody, for checking in on this beautiful day. Not quite as humid yet.
yeah, it's really nice.
Tomorrow.
I've been out in the yard already.
Yeah, I've already walked the dog, so. Okay.
Thank you.
Thank
Hey,
you.
have a great day.
You
Thanks,
too.
everybody. Nice
Bye.
to see all of you.
Good luck, Julia.
Yeah,
thank
thank you,
you.
Julia.
Thanks for coming.